So what is antimicrobial resistance? It's when organisms have the ability to stop antibiotics from killing them. It's when standard treatments of an organism become ineffective. When this happens, patients have serious illness and no way to kill the infection. This will increase healthcare costs with longer hospital stays and more admissions into intensive care units. So how can we stop antimicrobial resistance? One is the prevention of infection. We can prevent infection by recommending immunizations, by always educating about hand washing, and educating about staying at home and avoiding large crowds when they're sick, or wearing masks. We also can develop new drugs in diagnostic testing. So we need new drugs to kill these organisms that have become resistant to our old drugs. We need new diagnostic testing to check and confirm diagnosis of certain organisms, and by antimicrobial stewardship programs. Antimicrobial stewardship is simply being a good steward of the use of antibiotics. It's the commitment to always use antibiotics appropriately and safely, to only use antibiotics when they are needed to treat a disease, to choose the right antibiotic, and to administer the antibiotic the right way. So what is the right way? Here are some considerations for medication prescribing. When prescribing medications, you should always consider these components. An ethical consideration. This is important when the evidence that the medication actually works is weak, or when the safety of the medication is an issue. Parental education. Does the caregiver understand how to give this medication? Do they understand the side effects to look for when giving this medication? You should look at social issues like the cost of the medication or the availability of the medication. Then there's the consideration of the family. Was this a collaborative decision made by the provider and the family of which medication to choose? Who's going to be responsible for giving the medication? Smaller children, they don't really like taking medication. So can the parent actually give the medication to the child? For those families who have busy lifestyles, who's going to remind the child to take the medication? Lastly, the developmental level or the age of the patient should be considered. In infants, simpler dosing schedules should be given, especially for infants in daycare. For early childhood patients, they are now showing signs of independence, and they don't really want to take medication. So we want to consider, how does the medication taste? Can this medication be mixed with something that tastes good? For the middle childhood patient, we want to let the child decide if they want a liquid form or a pill form. And these children need to be monitored taking the medication. Can they even swallow a pill? We always want to avoid dosing during school hours for these children. In adolescents, we want to allow their input on which medication options they want to choose. Medication must be taken correctly in its entirety. If not, antimicrobial resistance can occur. We want to ensure medication adherence. Medication adherence is taking the medication like they're supposed to, when they're supposed to, for the amount of time they're supposed to. Here are some things to consider regarding medication adherence. Here are some guidelines for writing prescriptions. Please ensure you are prescribing accurately.